Okay, welcome everyone to today's webinar, Compliance Programming and the latest OIG compliance guidance. We are thrilled that you have joined us today. My name is Cassidy Avila, and I'm the program coordinator for the Texas A&M Health Rural Engagement Program. I have a couple of quick comments before I introduce our speaker. We are recording this webinar, and the link will be shared with you via email by the Rural Engagement Program within approximately 48 hours, as well as a copy of the slides. Following the presentation, we'll open the floor for Q&A, and you're welcome to submit your questions at any time in the chat, either directly to me or to the entire group, and I'll make sure they're addressed by Rachel during our Q&A. And so now I would like to take a moment to introduce our speaker, Rachel Pugliano. Rachel assists clients with the improvement of their revenue cycle functions at iBailey, as well as maintaining compliance with the current regulatory environment. Her specific expertise is in the mid-cycle of the revenue cycle, which includes revenue integrity, charge master maintenance, charge capture, and coding. She has more than 25 years of experience with a focus on compliance in all aspects of the revenue cycle, as well as proper code, charge assignment, and billing practices. Rachel, thank you so much for joining us today. We're looking forward to this presentation. It is all yours.
Okay. Well, thank you so much, Cassidy, for that nice introduction. I appreciate it. So just to kind of kick us off and get us started, I'll tell you a little bit about how I found myself in various compliance roles in my past life. So I started out my career as a coder, and from there, I moved into a compliance department for a medical center that was growing their compliance area in the space of coding. So I went from being a coder to auditing the coding. And from there, I was able to expand my skill set into working with all various aspects of compliance throughout the organization, performing risk assessments, working with other individuals based on hotline calls, any concerns that were really coming in through the organization. So with that, I just continued building upon that experience and working with organizations in a variety of compliance roles. And just to kind of set the stage for what we're going to be talking about today, it's really going to be focused on the compliance program as a whole and how that looks for an organization enterprise-wide. And I understand that not all of you may be compliance officers on this call, but if you work in revenue cycle in some capacity, if you work in quality, risk management, some of those types of areas, you likely work closely with the compliance officer or the compliance department. And so many of you should or could be involved in various compliance elements at your organization from a variety of levels. So really what we'll cover today is sharing the most updated general compliance program guide that was issued by the OIG. We'll cover what the essential elements are of a successful compliance program. We'll also talk through some data analytics options that help with risk identification, how to determine if your program is effective, and I'll also give out and list some OIG resources. So let's just launch right into the introduction for the latest general compliance program guide. And just a little bit of history of what's happened in the compliance world from an OIG perspective is that back in '98, the OIG issued their very first supplemental guidance for hospitals. And then beyond that, they issued supplemental guidance rather in 2005. So this guidance has been around for quite some time. And what that did is it established the compliance program and the guidance around what those programs would look like. However, it's generally considered voluntary on that OIG guidance as far as the elements are concerned, what it looks like at every organization. It wasn't until the ACA was signed and became effective in 2014 that having a compliance program became mandatory. Now, it doesn't mean that it needs to look exactly the way that the program is described in the OIG guidance. Again, it is considered guidance, but I think we all know that working with the government, oftentimes guidance is strongly suggested, and oftentimes having a program that looks similar to what the OIG has issued, it bodes well for any investigation that the organization might be in the midst of. It does come into play when they're establishing any kind of fines or a corporate integrity agreement. It becomes a good negotiation point if you're under an investigation or having to negotiate one of those corporate integrity agreements. Having a program in place does help with those conversations and those discussions. So we mentioned the Department of Justice in this slide as well, and they also issued guidance over the years alongside the OIG. And again, these publications were not mandated to be implemented, but again, strongly suggested guidance. It's really out there for us to follow and to give us a framework around what a compliance program should look like at an organization. So it's a good thing to take advantage of these publications. So there's been existing compliance program guidance in place for years, as mentioned, for hospitals. There's home health guidance, clinical laboratories, for third-party medical billing companies. So if we outsource to one of those types of companies, the guidance is appropriate for them as well. DME companies, hospice, Medicare Advantage plans, nursing facilities, physicians, ambulance suppliers, pharmaceutical manufacturers. It really covers all aspects of the medical industry when it comes to compliance programming. And they have issued specific guidance for these entities that we have listed here. We're going to be focusing on the hospital guidance specifically and talking through what that has looked like most recently. So really what happened in 2023 and then into 2024 is that the OIG completely changed their format for publishing compliance program guidance. In the past, they've always published it in the Federal Register. If you've ever read the Federal Register document or looked for something within that document, it's very difficult to read in that format. So they went ahead and updated the guidance in a much better format, in a more user-friendly uh, document that actually provides links to additional resources that organizations can utilize in addition to what the program guidance is indicating. And they've got some tips that they implement or insert throughout that guidance that one can take away and implement at their organization. So there's a lot of good information, again, much more user-friendly than it has been in the past. So in November of 2023, this general compliance program guide was published, and it applies to all individuals and entities involved in the healthcare industry. Now, in 2024, the OIG indicated that they were going to begin publishing industry-specific compliance program guidance for different types of providers and suppliers. We did not actually see that take place in 2024. What they did do, however, is they just recently issued a program guide for nursing facilities. So they were just a little bit delayed, I think, in their plan for the rollout of some of these industry-specific program guidances. However, we do have the general guidance from 2023, which is the most updated version, and that is in the new format that I just described. So just a note to remember, this general program guidance is non-binding and it is voluntary, and this piece has not changed. I think the thing to remember when it comes to the Affordable Care Act component is that compliance program does need to be in place at the organization. It may not look exactly like what the OIG program guide is stating, but it does need to be in effect at the organization. This program guide just gives you that framework that you can take and utilize to begin that program at your organization. So one of the big components of the program guide, and this has not changed over years, is that there are 7 essential elements of a successful compliance program at an organization. Those elements are the written documents, the code of conduct, policies and procedures, having organizational structure over the compliance program at the organization, so that leadership and oversight piece, a training and education program, effective lines of communication with the compliance officer, as well as a disclosure program for bringing compliance concerns to the leadership at the organization. The enforcement of the standards, as well as any incentives that might be in place at the organization, the risk assessment process, along with auditing and monitoring, and then what is the responding or the response protocols and procedures for detected offenses and developing corrective action plans around those. So those are the core elements of the program, and we'll get into each one of these a little bit deeper. So as I mentioned, the written standards will be that code of conduct. That code of conduct communicates the mission, the goals, and ethical requirements from the leadership at the organization to all staff and employees at all levels at the organization. Oftentimes, we'll see a signed introduction by the CEO as a precursor to the code of conduct. And what that's designed to do is really just send a message across the organization that there is a culture of compliance and that the leadership is dedicated to that compliance program and enhancing that culture. The policies and procedures, of course, are just really that those core functions around the compliance department and what the purpose and the structure is for the compliance program. But in addition to compliance related policies and procedures, we do want to see compliance incorporated into the day-to-day operations of the organization. So some ways to do that is how are we messaging our policies and procedures to staff? Are the policies and procedures easily accessible for any member at the organization? Are they easily found? Do they know where to go to read those and to find those? And are we updating and reviewing those on an annual basis? One piece that the program guide specifically mentions, and that is new, is indicating that relevant individuals should be able to easily access the code of conduct and the policies and procedures. So then that question is, well, who is a relevant individual? And how they define that is a relevant individual is a person whose responsibilities or activities are within the scope of the code of conduct, policies, and procedures. So this can include employees, contractors, patients, customers, agency staff, medical staff, any subcontractors, or people in other roles or a subset of the above. So essentially, what they're saying is that every single individual at the organization is a relevant individual. Also, any business partners, volunteers, any other adjacent vendors or companies that you work with are also relevant individuals. So they also need to be aware of and know about the compliance program at the organization. So one way to determine if employees know what the code of conduct is or how to access the policies and procedures is to include some questions around this during performance evaluations. Could be a simple question that's incorporated, such as, do you know who the compliance officer is? Do you know where to find our policies and procedures? If you have a compliance concern, do you know how to report it? That just helps give a bit of a pulse check at the organization on, is the information that's being shared around compliance being absorbed? Is it being retained? And has that message gotten across effectively at the organization? So next is the compliance leadership and oversight component. So this is initially establishing a compliance officer and appointing an individual that has the support and the backing of senior leadership as well as the board. This person should have appropriate authority and stature within the organization to be able to any kind of compliance initiative effectively and successfully. Oftentimes, we see this individual reporting to the CEO, but also having an independent access to the board if they need to access the board for a compliance concern. So we do want to see that accessibility there as well. Organizations should also put together a compliance committee for the purpose of supporting the compliance officer. And this committee should meet at least quarterly. We would want this committee to be comprised of relevant leaders at the organization from both an operational and a supporting department perspective. Another component of this, though, is including a board member on the compliance committee. And what this does is it also helps support and reinforce that culture of compliance from the very top levels of the organization. And having a board member tied into the compliance committee will just help with messaging awareness. If there is a compliance concern that is relayed to the board, they'll have some knowledge of that or at least some information on how to handle it potentially a little bit better. So that board oversight, all board members should be knowledgeable about the content and the operation of the compliance program. That doesn't mean that they necessarily need to be experts in compliance or understanding the program itself, but at least have that knowledge and awareness that there is a compliance program and have a copy of that program. They'll also want to be supportive members of the compliance officer and ensure that that individual has sufficient power and independence to perform the compliance functions of the organization. Another piece of this is having resources to also support that compliance function. So that might be in the form of a budget, some other avenues and resources from a personnel perspective, perhaps from a certification or educational standpoint that supports that compliance officer as well as the function. And then the board will also have compliance committee oversight. And by having a board member on the compliance committee, that really helps with that piece to assist with communication and really just looping them into those conversations around the compliance piece. Now, there are some compliance officers that will report directly to the board, but the organization does ultimately recommend that the compliance officer not provide any healthcare services and items that are related to billing, coding, or claim submission. And I do want to focus on that for a moment because I think we know that at our smaller organizations, we wear multiple hats. And it's not as easy to separate some of these functions from the compliance perspective versus some of the functions that we might be performing otherwise at the organization. But I do want to mention that they call this out specifically in the program guide around the billing and coding function. So I think that there's maybe some ways to work through that at smaller organizations with maybe some separation of duties. Maybe they're not as hands-on with the coding and billing function. Maybe they have some leadership or reporting that still has to be maintained just due to the size of the organization. But I do want to mention that piece, and we do get into some specifics later on in this presentation that relate to smaller organizations. The real driving message from the OIG standpoint is that the compliance officer should be independent from any duties that would impair their ability to succeed. So that also speaks to how many other duties or how many other hats do they wear at the organization? Because what we would want to see is that they do have time that they can actually dedicate to the compliance function. And if they have too many other hats that they wear, too many other leadership responsibilities, it might beg the question on if they actually do have time to perform their compliance duties as well. So that speaks to resources and dedication to the compliance program. One other thing too is that having a compliance committee in place does assist with some of this compliance work because some of it can be delegated to members of the compliance committee. It's not expected that the compliance officer is the only individual where compliance concerns can be addressed. There's leadership throughout the organization that can assist with this. So while we do want a robust committee and we want that committee to be made up of decision makers, we expect this to be a working committee so that all members of the committee are participating in the compliance function. I will mention too that the OIG offers a board education toolkit on their website. So that's a toolkit and a presentation that can be utilized to educate the board on understanding their roles and responsibilities for supporting the compliance function and supporting the compliance officer at the organization. The next piece here is training and education. And of course, this is a big piece at any organization. We have onboarding training that is typically always a part of our new hire orientation. And then we typically have annual training that takes place for all members of the organization. So not only would we want compliance to be a piece of that new hire orientation, but also it should be a part of the annual training that takes place. And just depending on the structure of the training that you have in place at your organization, this could be in-person training, or it could be through a virtual training such as what we're doing today, or maybe it's through a module. And I know some organizations have purchased some educational content that can cover a variety of compliance topics. One thing I would encourage is that there is some element of a personal touch point when it comes to the compliance training. And that is just from a visibility perspective. And it's really nice, let's say, if there's a new hire orientation taking place next week, that there's a time slot for the compliance officer to come into that training and actually meet those individuals face to face, and for them to put a face with a name, see that individual, and that just reinforces that organization's commitment to compliance. So if that's an option, I would highly encourage that to be performed as part of new hire orientation. Annual training probably can be conducted a little bit differently because typically we perform a lot of that annual training online or through some sort of an e-learning mechanism. So it might be more generalized at that point, utilizing the modules that maybe have been purchased, but then also including a slide or including some sort of communication, just reinforcing who the compliance officer is. Here are the ways that we can report a compliance concern and other communication pieces. And I've also outlined a little bit here around targeted training for specific roles at the organization. So we know in addition to our initial new hire onboarding training and orientation, we're going to have specific training once we get into our specific job role. And some of the more higher risk areas that the OIG looks at are the billing and coding functions, because that's directly tied to the processing of claims and reimbursement. There's the medical necessity component that can accompany or impact multiple individuals at the organization, not just the coding and billing area. Gifts and accepting gifts and other incentives potentially. That is one area that they highly focus on, and also sales and marketing practices. So there might be some additional compliance components that would be related to these job roles that you would also incorporate into the training at your organization. So some of the topics, again, the identity and the role of the compliance officer, sharing with the employees, the compliance committee and what their role is, stressing the open communication and open door policy at the organization, the different ways that individuals can raise concerns, and we'll get to some of into that specifically here in a moment. It's very important to share the non-retaliation policy, and communicating that by raising a compliance concern does not mean that they are going to be in trouble for doing so. Even if that compliance concern ends up being something that's a non-issue, let's say it's investigated, you find out that everything's okay. We don't want individuals to feel that they were wrong to bring that forward, even if it ends up being okay. So that's that piece around non-retaliation. And then the enforcement of the policies and procedures, which then speaks to disciplinary actions and those types of things when it comes to compliance violations. And then additional touch points and education outside of some of these annual training processes could be including a compliance topic on the agenda for some of your regularly scheduled meetings. If you have a executive leadership team that meets on a regular basis, incorporating compliance into that agenda, as well as any kind of revenue cycle meetings, those types of conversations always include a compliance element. And if you have a monthly newsletter that's published at the organization, maybe including like a compliance corner or some sort of messaging from a compliance perspective, doesn't have to be very long, can be very brief. Sometimes it could be reiterating some of the components that we just talked about on this slide, or it could be something new that's just been communicated from the OIG that you would like to share organization wide. So that's just some ideas of other ways to communicate about compliance throughout the year. And then with communication, we do want to stress that there's an open line between the compliance officer and all personnel at the organization. However, it's also okay for the staff to go to their immediate supervisor or a director of that department. They can go again to the compliance officer. Even going to a member of the C-suite is completely appropriate for them to report a compliance concern. One thing that the program guidance stresses is the ability to have an anonymous reporting option. So they do say that at least one anonymous reporting option should be available, whether it's a hotline, whether it's an email address that doesn't necessarily track their email address. Maybe it's a form on the website that they can complete and submit, those types of things. I know that some organizations have used a voicemail box that the individuals can call and leave a message. And that is technically an anonymous way of reporting a compliance concern. I do know that some staff have indicated that they feel like their voice would be recognized because in a small organization, we all tend to know one another. So that's really the only risk there is that some individuals might be hesitant to utilize that method just because of that reason. I do think that having a form on the website to fill out tends to be um, a pretty easy addition to the website. It usually doesn't take a lot of work to build that, and then an anonymous method is pretty much built in through the website or the internet. And then again, we just really want to continually stress the confidentiality for the individuals that bring the concerns and the non-retaliation policy. And I know that for any of you that are on this call that wear that compliance hat, you probably receive calls or concerns or complaints that might really not be what you would consider a compliance concern. And that's okay. And we would then bring in other departments or individuals to help address those things, such as HR or legal or another department. And you can then turn that over to them for them to take the lead in addressing that concern. The important thing is that we have a method for reporting and that individuals at the organization are utilizing that. And then the enforcement of standards is a very clear component of the program guide, simply because it's great to have all these standards, policies, and procedures and expectations around compliance, but then if we don't do anything when there's a violation of our compliance program, then that doesn't show that we're serious about it and that we're taking this to that level. So we do want to have a clearly publicized consequences policy or disciplinary action type policy. A lot of times this is housed within human resources, and compliance and HR work together to develop this policy and determine what types of violations would consist into each category, because some of those might be just educational consequences and non-punitive, others might be punitive. The most egregious violations might result in immediate dismissal, but that would all need to be outlined in the policy and be very clear to the employees at the organization. There's also the ability within the program guide to offer incentives and encourage participation in the compliance program. Of course, this would not be something that you would attach any kind of monetary incentive to, but it's more around recognizing individuals that raise a concern and mitigate a risk, perhaps. And if they're willing to be publicly recognized, it's really just showing that they assisted and really helped us find something and fix something and really decrease risk in a particular area at the organization. So it's just recognizing them for that. I know some organizations have used a term called a compliance excellence award, where individuals that have either participated in developing a portion of the compliance program, or maybe they have participated in the risk assessment, or really just went above and beyond from a compliance perspective, can be issued this type of an award. And it's really just a recognition that it's nothing that's necessarily attached to any kind of monetary incentive. So the risk assessment, auditing, and monitoring section of the program guide, it did receive a little bit more attention when they issued that in 2023. In fact, the risk assessment process itself was really not mentioned much in prior program guides, and it's mentioned quite thoroughly in the new program guide. So I think the OIG is really looking for organizations to perform these risk assessments, but not necessarily just as a one-time annual performance, but devising a way that they can assess risk throughout the year. We'll talk about some of those ways when we get into the data analytics portion. But The risk assessment is designed to identify, analyze, and respond to risk. And one of the ways that some organizations have chosen to tackle the risk assessment is just by utilizing the members of their compliance committee to talk through what do we think the risks are to the organization. Another option that some organizations have used is utilizing a survey and asking specific staff members, not necessarily an across the board survey, but selecting individuals to respond and asking what they feel the risks are to the organization. I've also performed these in person, which are, 15 to 20-minute meetings with individuals and really keeping it more open-ended around what do you feel are the risks at the organization? Maybe ask for 3 risks and let them speak to those risks, why they feel they're a risk, what they've noticed or seen at the organization. Sometimes it's based off of something they read or something they saw in the news. So it's really good to get some of these perspectives on why individuals think that the organization is at risk in a certain way. So, like I said, there's been an increased emphasis on the risk assessment. This is something that should be performed annually, but there could be ways that risk could be assessed throughout the year so that you can respond a little bit more proactively versus retroactively on some of these risks. And sometimes it's a matter of just pulling some reports from both internal and external resources. So if there's been a payer audit, CMS, MAC audit, those types of things, you can pull those results and gain some insights there, as well as any internal work that's been performed. Maybe there's been an internal IT security audit or internal coding quality reviews, those types of things. So those are all various avenues that where data could be collected to assess some risk in those ways. Again, you can lean on the compliance committee to assist with this. This does not need to fall just on one person's shoulders. I mentioned data analytics, and we can get into that a little bit further in this presentation, but identifying outliers and utilizing that information to assess risk throughout the year, and just having that be more of an ongoing assessment versus only a one snapshot in time. I did include a sample risk assessment summary, and this is really just to take that information around the risk and then determine what is our level of risk after we consider the likelihood of the occurrence happening, what mitigating activities do we have in place, what is the residual risk once we look at those mitigating activities, who is the owner of that risk, and this is just to help prioritize what those risks might be. I know that when I've sat in a room with individuals and going through all of the various risks that we've accumulated based on interviews or the survey. We put them into different buckets, and sometimes that helps organize them a little bit. Maybe there's a compliance bucket, a finance bucket, an IT bucket, and we divide them up in those various ways. And then we start prioritizing based on this risk matrix to see, well, what do we need to float to the very top of the list, and what are some of the things that can maybe wait until later in the year or even maybe until next year. And from that risk assessment, that's where we really start developing our compliance plan to include those top risks to the organization that we want to make sure that we address sooner rather than later, and then push those maybe lower level risks to later on in the year or maybe to the following year so that you can prioritize and utilize your resources most effectively. And so one of the things that goes into that conversation is ensuring that you have capacity to complete the various audits. There might be things that are high priority and are high risk, and they're, number one or number two on the list of things that you want to address from a compliance perspective. But if you don't have a resource internally to perform that type of audit, you may need to look externally for some assistance. And that's where resources come into play that I mentioned on that board slide is not only having a budget for compliance and an individual named as the compliance officer, but when they do need assistance, maybe from the outside to accomplish some compliance initiatives, we want them to have the ability to be able to do that. The guidance specifically mentions medical necessity to be included in audits, and medical necessity can mean a couple of different things. This could be around level of care, for example, or it might be more around the ABN process and billing out of tests that may or may not meet medical necessity per the coverage determinations. So this is a little bit broad in how they have that worded in the program guidance, but I think that both areas have been concerns for organizations over the years and in the past, and that's probably why they have that on the program guide. And then we do want to have some sort of a monitoring program in place in addition to performing audits. So some monitoring activities that are probably already in place at your organization is the monthly screening of providers for exclusions, the annual review of policies and procedures, the billing, coding, and documentation reviews that typically take place on an annual basis at most organizations. And if these things are not in place at the organization currently, this would probably be a good starting point of some activities that could be in place to facilitate that routine monitoring program. The OIG also published a separate toolkit that speaks to assessing program effectiveness. And it's a large document. I want to say it's 52 pages, and it somewhat reads like a checklist, and it gives you the impression that they would like to see all of these pieces as part of the compliance program under each one of these 7 elements. And I will have a link to this at the end of the presentation, but one thing I want to stress is that the toolkit is not intended to be a checklist, even though that's kind of what it looks like. It's to be used as a tool for developing the program and taking it as a list of ideas and ways that you can evaluate your program and utilize different resources to build your program. So that is the intent of it. And I do have that link at the end of this presentation for you. So some additional thoughts around this section is any initial assessment of the compliance program would be and will need to include a baseline audit. So if you are starting your program, or maybe you haven't revisited your program in quite some time, you would want to include that information and consider that a baseline, and that to be your starting point. And then the ongoing monitoring piece would be building upon that. So any of the audits and any of those initial assessments that are performed, that will be like, like I said, that starting point. And then there might be a re-audit, some ongoing monitoring, some pieces that you address maybe from an educational perspective that would be included in there. And that auditing and monitoring piece does not need to be a time-intensive or an expensive endeavor. Sometimes it might just be a quarterly review of a focused area. For example, maybe this quarter we're going to focus on reviewing some claims from the emergency department and ensure that we've captured all charges, the documentation supports all of them, we have the modifiers assigned correctly, those types of things. And you could go through that on an annual basis and develop the focus areas that you plan to look at for each quarter. And that essentially is somewhat of a monitoring and auditing program right then and there. So the last piece here is responding and developing a corrective action plan. So this is the responding piece to any compliance concerns that are brought forward at the organization. So a lot of times when we have a hotline, for example, we will automatically receive a report from whoever that vendor is that's managing that hotline for us. And if you're doing that internally on your own, you would still want to have a log, whether it's an Excel spreadsheet or whether it's a paper log, something that's keeping track of every compliance concern that's brought at the organization. In addition to logging, we would want to have some dates and times noted, as well as when we responded to that compliance concern. Did we respond within a couple of days? Did we respond in 2 weeks? We want to be timely about that response. We might find out during our investigation into that compliance concern that all is working well, there isn't anything to be concerned about. We're validating that we are doing things properly, and we would want to document that as well. If the person that brought the concern is not anonymous and you know who that is, it's always a good idea to circle back with them and let them know the outcome so that they know that this was investigated, we took a look into it, and this is what the finding and the outcome was. To as much as you can, share that information with those individuals. So it's really about collecting and keeping that data and be as detailed as possible in case you ever need to produce that information to an external source. So when it comes to reporting to the government, that's when we would want to work with our legal counsel on the nature of the compliance concern. What is the volume or how big is this concern? What are we talking about from a either a how many times it's occurred versus maybe how many dollars we're considering here, and work with legal counsel to report that in a timely manner. The OIG website actually has a disclosure section on the website and a link to self-disclose, and it does include information around that, but I would really encourage you to work with legal counsel when it comes to these types of things. Once you've determined what the compliance concern is or the compliance violation, you do want to refund any overpayments, but then we want to look at the root cause. What was the gap or what was the process breakdown that caused this to happen? Was it an educational opportunity for either providers, billers, coders, or some other individuals at the organization? Was it something that was just completely accidental and maybe something wasn't set up in the system properly and we just didn't know it and we didn't catch it? Or was it something that was more egregious and intentional? And that's where your disciplinary policy is going to come into play with some of these decisions and the follow-up regarding corrective action. In some cases, you may, and really in most cases, you're going to want to have this corrective action plan documented in some sort of a template where you have the violation, the disciplinary action that was determined, and what the follow-up was to that. Sometimes when this happens, there's a lot of HR collaboration. And so some of this paperwork might be housed within HR and in the employee file. So it just really depends on what that corrective action is. If it's something that's more broad and not necessarily something that a person did incorrectly, but maybe speaking to a system breakdown, maybe there was an issue with claims processing and there was a system glitch where a modifier was being applied inappropriately and automatically because of something that was built incorrectly. Those things, once they're identified, that's when we want to address those, and we might have a corrective action that's more around auditing our systems and determining how this build is set up and understanding that a little bit better. So it's really just going to be unique and dependent on the situation. So here's a section that I've included for programming for small hospitals or small organizations. And I'll mention that it's not drastically different. And I was really hoping that we would see some more specific guidance, if you will, around how smaller organizations should approach their compliance program. I do think it is helpful that this is in the program guide because one of the messages that comes out of this section is that your compliance program is built to scale. The OIG does not expect a compliance program at a critical access hospital or a small PPS hospital to look the same as the compliance program at an academic medical center. So we know that they don't expect that. And I think that's good that we understand and know that. And they do designate that maybe you don't have a compliance officer at your organization, but maybe it's a compliance contact that's responsible for compliance activities. We still would need to have policies and procedures in place. We still want to be conducting education. So there really isn't anything that allows for leniency in those areas. We still need to have those things in place. And they do indicate that maybe a formal disclosure program may not be necessary, but personnel still need to understand the organization's commitment to compliance and the non-retaliation policy. So I think the message here is create user-friendly processes for staff to report compliance concerns, even if they use the example of a Dropbox. Being able to just fill out a card and drop it somewhere in the hallway of the organization so that there is some method of reporting compliance concerns. Again, risk will still need to be assessed and identified. I would say in smaller organizations, utilizing a survey tends to be a great way to conduct a risk assessment. We still want to perform coding and billing reviews. And again, those would be to scale. It would be dependent on the types of services that the organization provides and their volumes. Enforcing standards is still going to be a requirement and having appropriate disciplinary measures, returning of overpayments, reporting to government agencies, all of those things really do remain in place. I think they've just tweaked a couple of portions in that small organization section that can assist with a little bit of flexibility for those smaller hospitals and entities. So I know that we only have 15 minutes left, but I do want to touch on data analytics here briefly. And that's more of a communication that came from the Department of Justice some years back on how they expect to see organizations utilizing data in order to assess risk. And they're actually asking their investigators to look at that when they're conducting their investigations. So, do we have a way to utilize our data appropriately to identify risk? And some of this might be just as simple as looking at your denials dashboards. Do we have dashboards? Do we have access to this kind of data? Are we using it effectively to help guide us in some of our decision making and root cause analysis? So the three fundamental questions that the DOJ uh, posed is the corporation's compliance program well designed? Is the program being applied in good faith? Does the program work in practice? Excuse me. And then going deeper into that, are they performing a risk assessment? Are there policies and procedures? I'm so sorry, I just decided to lose my voice. Is there training and communication programs in place, a confidential reporting structure? And then what are we doing around third-party management and mergers and acquisitions as well? Again, looking at some of the effectiveness components and what the DOJ has published is looking at that commitment to compliance by senior and middle management, not just necessarily the leadership, but is that translating down any incentives or disciplinary measures? And then autonomy for the compliance officer. And again, is that compliance department adequately resourced? And really, this is all just a reiteration of what the OIG has also indicated is that continuous improvement with periodic testing, investigation of misconduct, and continuing that analysis and looking for the underlying reason for the misconduct or the violation or the compliance concern that was brought forward. So this is the piece around utilizing technology, and some of it is very simple types of things like evaluating your E&M levels utilizing a bell curve. That could be something that could be run based on revenue and usage data on a monthly basis. We would want to do that more continuously versus just a snapshot in time. I have edit management here. Given that we have edits set up within our system in a variety of capacities. We might have a claim scrubber edit, we might have NCCI edits, we might have edits built within our encoder. We want to make sure that we're not only not duplicating edits because that would be inefficient, but that we're not turning an edit on in one area just to turn it off in another area. And what we thought we set up and is in place ends up being undone further on in the revenue cycle. That's just one example for edit management. So these are just some ways to utilize technology to ensure that we have things set up the way that they should be for the organization. Having a drug diversion program, continuing with any kind of monitoring and reporting functions, and just solidifying those in some sort of a procedure and policy at the organization. Just wanted to share a picture of what a denials visibility dashboard might look like. These are just ways that You can manage your denials and also identify root cause and determine where do we really need to spend our resources and our time when it comes to addressing denials and potential compliance concerns. And I include a pricing defensibility dashboard only because we know that price transparency is another compliance component for organizations at this time, and there's been some changes around that recently as well. So there's a number of things that you can use data and data analytics to help build some of these types of dashboards just to have visibility on this information. So I talked a lot about the OIG, but it actually is a really good website, and they include a lot of good information on that website. So one of the things that they have is some various toolkits. They have a telehealth toolkit, a program effectiveness toolkit that I mentioned earlier, opioid misuse, the healthcare board training toolkit is out there on that OIG website. Of course, we have the OIG work plan, which I'll talk about a little bit more here momentarily. And they include reports and publications around a multitude of topics that may or may not be pertinent to your organization, but I just want to highlight that that information does exist and it's there. They also have advisory opinions that they publish, legal opinions, fraud alerts, various bulletins, and you can sign up for these types of listservs as well. They have FAQs, they have a self-disclosure page that I mentioned. They talk about corporate integrity agreements and they give some resources around those that have been published and include some examples. They also have a resource under the integrity agreements for small organizations that might be worth checking into as well. Enforcement action summaries just really highlight some of the things that have taken place at other organizations just for your reference. And I already mentioned the self-disclosure program, and that's a resource for healthcare fraud that can be utilized. And there's a link for those online submissions. The OIG actually has their own hotline as well. And so they will accept tips and complaints. They do indicate that they might not always circle back with the individual that issued the complaint, and that's mainly just due to staffing and resources and the inability to do that for every complaint that they receive. They do include information though on the complaints that they do and do not investigate. So you can see a little bit about their thought process around some of those. So the OIG work plan has historically been something that was published once a year. I remember, a number of years ago, we would wait for the work plan to be published, usually in the fall of the year, and we would utilize that work plan to then develop our annual work plan internally for the following year. Well, they stopped with that type of a practice some time ago, and now they can continuously update that work plan. So it's a really actually a good idea to maybe put a reminder on your calendar to look at that once a month and see what might be new. I want to say for the month of May, there were maybe 8 new items. It was definitely less than 10. Not all of the items are going to be CMS or Health and Human and Services related. I did notice that recently it seems like there is a lot of National Institute of Health work plan items. And I think that just speaks to the focus of the current department and administration on the things that they have highlighted as being priorities. And so you do see a little bit of that shifting depending on, like I said, the administration and what their focus is at the time. So these are some current work plan items that may or may not impact your organization, just depending on the services that you provide. But skin substitutes has been a focused area for quite some time. I did remove the opioid misuse line item here just because I ran out of space, but that is something that really hasn't gone away and that really pretty much maintains itself on the work plan. They are performing an analysis of Medicare payments as compared to what the hospital's published prices are, which is not surprising. They've had the price transparency guidance in place for a number of years, and so I guess it was just a matter of time before they would start mining that information. Somewhat related to that, they're doing an audit of Medicare claim line item payments, which exceed the hospital charge. So that's really not directly related to what the hospital charge is so much as what Medicare has decided to pay for those services. Remote patient monitoring is on the list because we have had new codes that have been developed in recent years related to these types of services. And then incident two is also on the current work plan. There are a number of other items as well, but they may or may not be applicable to your organization. So when it comes to program effectiveness, here's some of the challenges and successes that I've just noted over the years with doing program assessments. And if there is a lack of a culture around compliance, or there really isn't a leadership buy-in to the necessity and the importance of a compliance program, that's going to be a huge challenge for a compliance officer or others at the organization to move forward any sort of compliance initiatives. So that would be a barrier if we don't have that type of buy-in. If we don't have the appropriate authority, bestowed upon the compliance officer and that proper reporting structure, that's going to be a challenge for that compliance officer to be able to do the things that they should be able to do at the organization from a compliance perspective. There might be some systems and data limitations, and that would just speak to the reporting capabilities, the dashboards you're able to create, the information that you're able to glean out of your system in order to gain some insights into where your risk areas might lie. And then, of course, resource constraints. And I know that resources from a compliance perspective, as well as many other areas across the organization, is an applicable challenge. It's not just related to the compliance function. So I think that as much as you can resource your compliance officer or your compliance area, at least by giving them some educational opportunities, the ability to have the time to perform some compliance work, that's where we need to try to give them at least those resources to do those pieces. Successful programs have leadership engagement. They're speaking out about the culture of compliance. They're front and center with that type of messaging. If we have some tools that we can utilize to create some graphs and some charts to really show some trends and visualize that data, that's very helpful. Having internal as well as external assessments performed, whether that's a coding and billing review, whether that's work that you're doing in the quality area, cybersecurity type things, those types of assessments are important to be conducting at the organization for success in this area. And then, of course, ease for access for employees to communicate any compliance concerns, look up policies and procedures, knowing where to find the code of conduct, and understanding what the expectation is at the organization to be engaged and report compliance concerns. So a compliance assessment typically, and this can be done internally as well, is designed to just look at the 7 elements of compliance and determine, do we have these elements in place? What is our organizational structure? What policies and procedures do we have? Do they need to be updated? When's the last time we looked at our training and education materials? What communications have we put in place so that employees can bring forward compliance concerns? That disciplinary action piece, which would fall under your policies and procedures as well. Look at auditing and monitoring activities throughout the organization. Compliance should have some knowledge or know what types of audits are being performed so that they can be prepared to respond in the appropriate manner and accordingly. And I do have a list here of what the assessment involves, with the review of documents, meeting with various individuals at the organization. This is something that the compliance committee could do, is perform an assessment like this, or the compliance officer is something, like I said, that can be performed internally or externally if there's no resource to do that internally. And it just gets the compliance program either up to date or off the ground, just depending on where you're at with that journey at your organization. So some top challenges that I found in program assessments is that everyone's at a various level of program development, and that's okay. Some have a very robust program, others may not. There might be board involvement, others may not. So everyone looks a little bit different. Of course, COVID had an impact on some of those things as well. So there's some challenges there with getting some of these programs up and running again. And I know we're out of time, but Here are the links to some of the documents that I spoke to in this presentation. You can find the program guide here, as well as that toolkit that I mentioned. And I apologize, but we're probably out of time for questions. But if there's anything that you would like to chat about, my information is located here. Feel free to email me, ask a question, obtain any information that I wasn't able to provide today. I'm happy to do so.
Thank you so much, Rachel. We are at the top of the hour now, but if I'm willing to stay around for a few minutes, if you have a minute or two, if there are any questions, I don't see any in the chat right now, so it looks like we
Okay.
may not have any. But now would be the time if you have one. I'm going to make a couple of quick announcements to close. So feel free to interrupt me if you want to unmute or go ahead and type that into the chat. I have launched a poll. It's just 4 questions. So if you have a moment, we would appreciate you completing that. I'm also dropping right now into the chat 2 links for you. One of those is to the Rural Engagement Program's website, and the other is just to our technical assistance inquiry form if you would like to inquire about receiving technical assistance from our program on the topic that you've heard about today or any other topics that you see listed on our website, then you would reach out to us through that form. Okay, I don't see any questions, Rachel. And I don't
Okay.
see anyone with their hand raised. So since we are at right after 1, we'll go ahead and adjourn. But I appreciate your time, and I want to thank everyone that joined us today for your time as well. And do reach out to Rachel or myself if you have any follow-up questions. We appreciate you. Thank you so much, Rachel.
Thank you.
Bye-bye.
Bye-bye.